Did you know recently it's been scientifically proven that exercise and therapy can heal a broken heart? So bro science might have been right all along. The world's first clinical trial just proved that hitting the gym, swimming, cycling, and even doing therapy sessions can literally repair your heart. So I read this article so you don't have to, and here's the breakdown. Science just officially showed that therapy and exercise, especially exercise, can mend what doctors call a broken heart. And we're going to get into that mouthful, what it's actually called. Now, I'm going to explain it to you step by step, and then we'll look at it from a martial arts lens. Let's get this started. So what is broken heart syndrome? Now, most people think of a broken heart as just emotional pain. You lose somebody, go through a bad breakup, life hits hard, and it just sucks, but it goes a little bit deeper than that. It's actually a medical condition called cardiomyopathy. I know it's a mouthful, basically broken heart syndrome. Now, here's what happens. Severe stress literally changes the shape of your heart muscle and it weakens it. Your heart balloons out into a different form, and that makes it hard to pump blood. And they say it almost feels like an actual heart attack. You get chest pain, shortness of breath, all of it. And the scary part, people with this condition have twice the risk of dying early compared to the average person. Some people even end up with heart failure, which means chronic fatigue, shortness of breath, and your lower life expectancy. People could literally kill you by breaking your heart. And up until now, there's been no cure. Doctors couldn't reverse it. They can only manage the symptoms. Now, when it comes to this breakthrough study, doctors ran the world's first randomized control trial. Now, that's a gold standard, and I'm gonna tell you why this is important in science. Not just a survey or some theory. They took 76 patients with broken heart syndrome. Now, most of them were women in their 60s, but they split them up into 3 different groups. One group got cognitive behavioral therapy. I have to remember that one. Basically, that's one-on-one therapy, but it was specifically adapted to their heart condition. Now, their second group, they did a 12-week exercise program. They were swimming, cycling, aerobics, increasing the intensity each week. And then you had a third group, they just got standard care, regular medication, and advice from their cardiologist about their heart. And the idea was very simple, but it was powerful. They wanted to test what you call the brain-heart axis. In other words, can training the mind or training the body actually fix the heart? And this is what they found out. Let's talk about the results. We're going to talk about the therapy, just talking. What did talking do for these patients? They actually got stronger. Their walking distance increased. They had like this 6-minute test. It went from 402 meters to 458 meters. Their VO2 max, that's basically how much oxygen can your body use at peak exercise. It went up 15%. The exercise group, the numbers was even bigger. Their walking distance went from like 457 to 528 meters, and their VO2 max, the oxygen for their peak exercise, it went up 18%. And they used advanced scans to check to see how the heart produced and stored energy. And both the therapy and the exercise groups, they had way more fuel for their heart to pump. Now, the standard care, the regular third group, nothing changed. Nothing literally happened. So it wasn't just about people mentally feeling better. They actually saw that talking and exercise was recovering the heart. So why does this all matter? I mean, it seems like a no-brainer, but think about it. For decades, broken heart syndrome had no cure. Scientifically, it was just bro science. Go to the gym, bro. But now we know exercise and therapy, 2 low-cost non-drug treatments, can give people their heart and their health quality back. It proves what a lot of us already believe. The mind and the body are indeed linked. They call it the brain-heart axis. It's real. Stress can damage your heart, but movement and your mindset can repair it. So now let's look at this in a martial arts lens. And this is where it hits home for me. In martial arts, we always know movement heals. We've known this. The mind and body have to train together. You have to sharpen your mind, you have to train the body, and over time, it literally rewires how you perform, how you feel, how you recover. So whether you're a fighter or just somebody, dealing with Takotsubo cardiomyopathy, broken heart syndrome, remember, exercise and therapy aren't just good habits, they can save your life. And that's the study, that's the takeaway. Science just proved bro science basically right. Training really can mend a broken heart. So what do you guys think? Comment below.